topic is Those Eyes Speak a Lot. This is a very interesting case study. We did this study to evaluate the cause of the choroidal folds in two patients with no other obvious ocular findings. Methodology. We conducted this study at Sarakshi Netralaya, Nagpur. It's a case report study done on the two patients complaining of the headache and the insomnia were routinely examined for the ophthalmic evaluation. Fundus examination revealed choroidal folds with no other significant ocular findings, and multimodal imaging was done, including the fundus photo, fundus autofluorescence, OCT, retroimaging, OCTA, and V-scan, along with the systemic investigations. So, starting with the case 1, there was a 54-year-old female presented for headache and insomnia. Her BCA was 6.6 in both eyes. Anterior segment was within normal limit. Fundus examination revealed choroidal folds at macula in both eyes. Both eyes fundus photo, OCT, retro, FAF, OCTA, and V-scan was done. Both eyes CT and MRI done to rule out retroorbital lesion if any, except for the axial length, which was in the range of hypermetropia. No other positive finding was suggestive of the secondary choroidal folds were noted. On color fundus photo, there was an undulation of the RP involving the macula. OCT revealed combined undulation of the retina, RP, and the choroid. FAF revealed alternate hyper autofluorescent and hypo autofluorescent bands. Retromold revealed taut bands in all over the posterior pole. OCTA revealed prominence of the lines of the choroid, chorocapillaries, outer retinal choroid complex, and all the level there was no evidence of any underlying pathology. B-scan revealed increased CRT. Now case 2, there was a 43-year-old female presented with headache and the blurring of vision. On examination, her BCA was again 6.6 in both eyes, anterior segment was within normal limit. Fundus examination revealed choroidal folds in macula in both eyes. Again, same process was followed. There was no positive finding was suggestive to the secondary choroidal folds, and the patient was advised blood investigation, which revealed deranged T3, T4, and TSH values. Again, color fundus photo revealed undulations of RP involving the macula. OCT again combined undulations of the retina, RP, and choroid. FAF here revealed alternate hyper-autofluorescent and hyper-autofluorescent bands, retromode, taut bands in all over the posterior pole. So choroidal folds are the striae which predominantly involves the posterior pole of fundus. These are usually arranged parallelly in the horizontal fashion and reflects the undulation of choroid, retinal pigment epithelium, and the neurosensory retina. These lines vary in the length and width and rarely extends beyond the equator. These lines can be idiopathic when no known cause is found, or secondary to a variety of conditions ranging from benign conditions like acquired hyperopia to inflammatory conditions, tumors, or post to surgery. So my conclusion is routine fundus examination and thereby multimodal imaging helps in the diagnosis and assessing the systemic disease like diabetic retinopathy or hypertensive retinopathy. In our study, it helped for the earlier diagnosis of the thyroid eye disease. Thank you.